Hi, everybody. It's me, Dr. Kessler from Lorain County Community College. Welcome to today's COVIDeo. Today's April 2nd, and a lot to talk about today. Today, the number of cases of COVID-19 will go beyond 1 million. Also, we are reaching the point of 50,000 deaths, or that we've already exceeded 50,000 deaths in the world. And that brings up an important concern that people have been telling me about or asking me about, and that is, how do you handle um, the departed? Let's just put it that way. Well, I can tell you this, that one of the principal ways that Ebola virus would be passed from person to person was upon somebody's death. There would be a grieving process, and the virus got spread to the survivors. And that was a big issue. And one of the things that we had to do, we had a problem in the HIV community about how to handle the dead after an HIV infection so that there would be no threat to the survivors. And that's a big issue. It's a big problem. It is something that you can find information on. For one, there is a concept of virtual funerals going on. The people are talking about doing virtual funerals, and that might be a useful solution. All right, today my temperature is 35.4 centigrade or 95.7 Fahrenheit. I want to talk a little bit about the response, and this is a letter to the editor, an editorial from Harvey Feinberg. He is was the dean and still is the dean of public health at Harvard Med. I think he's been there since I left that institution, so he's been there for a while. And he lays down some principles that we need to do as a whole country. We need to, first of all, establish control, firm and decisive control. We need to expand testing way beyond where we are. We need to have testing and retesting and testing again, because that'll enable us to do something that I'll talk about in 2 seconds. To ensure supply of personal protective equipment. That is a very important thing going on right now. We're going to need to get all kinds of things to make sure that our health care in Ohio right now, for those of you listening in Ohio, most of our cases, or many of our cases, a good fraction of our cases, are healthcare workers, and we have to make sure that we're keeping them safe. The next one is a little bit more complicated, and this only comes with testing. Differentiate the population. We need to know who is naive, who has not been exposed. We need to be able to separate them from who has and who actively has the disease, who may be having a mild case of the disease and carrying it, and from who has definitely recovered from the disease. This is an important thing that we can do to figure out how to help us all. Let's see, we need to get the public involved with this. Staying at home, I'm going to have a whole talk about that in just a couple seconds, about how staying at home is actually working and flattening and doing the right job. And then we also have to activate the research community. There are a lot of labs right now that are idle. The research community is idle because they have been sent home by their universities. We are now not working. I'm working from home, not from the lab at all. And we need to get those people back to work, inspire them to work extra hard, and come up with solutions. That is an important piece. I always remember, I can remember that I think it was Richard Nixon who declared a war on cancer. And did we defeat cancer? No, we did not defeat cancer, but boy, did we do a lot of good. We did a lot of good with that. There have been some tremendous findings that have occurred. There's some tremendous treatments that have occurred, and that's a really good thing. I want to also point out that a question that I have been asked in the past was about pregnancy And do I need to worry about pregnancy? Am I going to be in trouble with my baby in trouble? And this is a letter that came to the New England Journal in last night's edition, and it's about a patient who delivered a baby without complications. Carried it, and this is a patient who had COVID infection. I want to talk more about masks, universal masking. Even if we get to a differentiated status where we know let's say I know I've been infected, I know I am cured, there's a case to be made for me to continue to wear a mask in the hospital setting. Let's say I'm working in a hospital, because you're not going to be able to see my immune response. You're not going to be able to, you're going to rely on me telling you, oh yeah, I'm immune. And so I think that we all need to be, no matter who, in masks. And we got into a discussion about what kind of a mask works, what kind of a mask is best. The most perfect mask is to, be totally sealed up in a bubble. But that's not a useful kind of a thing. The most perfect mask is one that filters out 100% of the virus, et cetera, et cetera. But even small things can be helpful. Remember, we all use seat belts in our car. Could we still perish in an accident? Yes, we could still perish in an accident. But wearing of the seat belts is definitely something that is going to be beneficial and is going to help us and reduce the number of cases. So a little bit helps, even if it's just a little bit. Remember, a sneeze is a very projectile thing. A sneeze makes you, is where a violent force of fluids are leaving your body. All right. I want to talk a little bit about this and tell you some of the good news. We live in that big gray area. Us in Ohio and the folks in New York and Michigan, Wisconsin, we're all in that gray area there. In the gray area is where we are under mandatory do not leave your house, shelter in place orders. And it's working pretty well for us. I just want to point that out. Because if you look at the little boxes around the side of this, I have outlined some of the numbers that are of cases that are out there, and some of the rates. And you can see in the state of Ohio, we have knocked down the rate from, and I'm going to just put my glasses on here to look so I can see my teleprompter here. We have knocked down the cases to about 1.14% growth. And the difference between 1.4 and let's say 1.3 means that is a very big difference. That means you're going to be doubling at a much faster rate. And then you look at some of the places that are not in the boxed in lines there, in the black outlined states, and they are having it worse. Florida is probably where we still have some growth going on there. They were at a very high rate once upon a time, and they've controlled it a little bit, but they're still quite high, and their growth is going to continue. New York has brought their rate down from a very big high down to quite a bit less. That 1.37 per day increase in growth rate to 1.14 is good. What you want to do is have a growth rate of 1. That means it's not growing at all when you look at the numbers. And so hopefully we can all get to that point. And people are asking me, well, wait a minute, aren't we going to be stuck with this forever? Well, not necessarily. If we can get to a point where where there is no growth and everybody stays in place, in about 2 weeks' time, viruses need a host. Viruses are an obligate intercellular parasite, which means they need a host. They cannot survive without it. And if there's no hosts and there's no virus surviving on surfaces, well, then we're good. And if we can get people who are infected to stay inside and get them through this, we will be able to get through the whole thing and come out. And then we still should work hard on trying to find that vaccine. We still should work hard on treatments and such. I promised you I'd talk about treatments. I am still working through it. It is a jungle of information about effective treatments, and there is arguments going on in the literature about something being really great and something really being no good at all, or actually bad. One drug could be really good or bad depending on the situation. We're trying to sort out a lot of information in a quick time. I'm going to stop right there and thank you all for tuning in to today's edition. Remember to be good to each other. That's how we get through this, being good to each other. And may you all persist like a lentivirus. Thank you and have a good day.